Hi, my name's Ollie Hulson. I'm a radiology consultant working in Leeds teaching hospitals, and I've been a consultant for coming on for 5 years now. My main areas of interest are oncology imaging, urological radiology, and specifically prostate diagnostics and therapeutics. And within that, I'm involved in reporting multi-parametric prostate MRI. I set up the Transperineal prostate biopsy service in Leeds, and I'm involved in the prostate brachytherapy service in Leeds as well. And the image here is the Leeds Cancer Centre, where I spend most of my waking hours. So as I said, my professional interests relate to multi-parametric prostate MRI, particularly a good quality acquisition and good quality reporting. I'm interested in prostate biopsy, and particularly transperineal prostate biopsy under local anaesthetic, which I was involved in setting up here in Leeds, and template prostate biopsy mapping as well. And we're in the process of doing away with transrectal biopsy in the region. And I hope by the end of the year, most centres in West Yorkshire will have moved to transperineal prostate biopsy. And as I said previously, I also have a role in our prostate brachytherapy service. And as part of the prostate therapeutics scene here in Leeds, we're currently exploring focal therapy for prostate cancer as part of an extended research trial, a multi-centre trial. And I'm sure that in the next 3 to 5 years, focal therapy will come to the forefront, particularly for localized organ-confined tumours. So I wanted to talk to you a bit about multi-parametric prostate MRI, particularly what it is and why it's of benefit to patients. So as the name suggests, it's a study, an MRI study consisting of multiple parameters. That's where the multi-parametric comes in. And the parameters can be divided into anatomical and functional sequences. So here we've got multiple images from the same patient, and the T2 weighted image at the top left delineates the anatomy of the gland in high resolution detail. The functional parameters look at the prostate at a cellular level, particularly the density of the cells within the prostate and also the enhancement, so how the cells take up contrast medium, and that relates to how vascular the cells are and the blood supply to the prostate as well. And the benefits of this is it can highlight areas of interest and areas of high-grade tumour within the prostate. And also, conversely, it can highlight normal tissue and hopefully avoid a biopsy for patients that are deemed low risk, so with a low PSA and a reassuring MRI scan. But the importance here is that we acquire good quality MRI imaging and we provide a good quality report. And there's lots of work going on across the country and across the world in both of these domains. And certainly in Leeds and in Yorkshire, we're looking at rationalising our MRI protocols across the region to improve the quality and also to improve the reporting and sharing of information throughout the region. The benefits of this also are that it can help to target our biopsies and also target the therapy. And I touched on focal therapy before. That's when we treat perhaps half a gland or a quarter of the gland based on where we've established there is tumour from the MRI scan and also the biopsy, and thus reducing the side effects of any treatment that we can offer. And as I said, I think this will be coming to the forefront in the next few years. As I said previously, I have a lot of interest in prostate biopsy, and particularly transperineal prostate biopsy. And the service we offer in Leeds, we utilise the BIopsee Fusion software system. You may wonder what Fusion offers in advantage to other types of biopsy. Well, it allows us to overlay the MRI findings and any areas of interest or any focal abnormality that we've seen on the MRI scan onto the real-time ultrasound image. And this allows us to target our biopsies very accurately to within a millimetre of accuracy, allowing us to ensure that we've hit the right area within the prostate and also allowing us to reduce the number of biopsy cores we need, because we know that we have been very accurate in our targeted biopsies. There are other systems on the market, but the reason I adopted the biopsy system is that it's very reproducible, it's straightforward to use, and it allows us to perform this transperineal targeted biopsy under local anaesthetic in the outpatient setting. So this procedure will take roughly 30 minutes. It's very well tolerated. The patients can go home shortly afterwards, and the side effects and complications are kept to a minimum. I hope you found that brief overview of multi-parametric prostate MRI and targeted transperineal biopsy of interest. If you do have any further information, please do get in touch via the Prostate Matters website, and I'd be happy to discuss any of this in further detail if needed. Thank you.